Hello, I'm Tamara. Actually. Hello, I'm Tamara Tellis. I'm a public health diversity advisor at the Larson Institute for Health Impact and Equity and graduate student school at the School of Public Health for the University of Nevada, Reno. My poster presentation is evaluation of a health and policies approach for systems advancements in health equity. So the Nevada Office of Minority Health and Equity, in partnership with the Larson Institute, initiated a series of 7 pilot projects designed using the health and policies approach, which was proposed because of the methodology and policy and programming development. The goal was to minimize practices that contribute to health disparities experienced by minority populations by collaborating with agencies whose service areas address social determinants of health, which are typically those who are non-traditional public health partners. So as you see from the project timeline here, it really took about 2.5 years to complete, really focusing originally on developing an advisory board to guide those 7 pilot projects and identify them, developing a health and policies 101 training, implementing and executing those pilot projects, and really providing policy recommendations from those pilot projects and completion with an evaluation and final reporting. So with the training, our goal was to enroll at least 20 participants in that health and policies 101 training. We ended up quadrupling the goal amount to 80 trained. 100% of the participants mentioned that they had a better understanding of health and policies. The evaluations really indicated an increase in knowledge, an increase in desire to implement concepts by building partnerships and bringing concepts to external affairs groups, and then proposing a program evaluation. And the need for further training was identified in strategies for policy change, pitching concepts to team members, and changing direction in the midst of world events. So evaluation at a glance, 100% of our partners mentioned that a public health perspective is truly beneficial to their work. 5 of the 7 partners mentioned that whatever product outcome that they had from their pilot project was easily utilized within their work immediately. And then also 5 of those 7 partners also mentioned it was their first time ever working with a public health entity. So in the evaluation, there were 4 key themes that were identified. The first was partnerships and collaboration and intersectoral opportunities. This was really focused on highlighting that the use of health equity lens within their work was really beneficial, really understanding what are social determinants for health inequities and how to utilize a health equity lens. It also created natural synergy for expansion within their projects or development of additional project collaborative opportunities. And it also provided a new pride in their work, really understand that whatever they're accomplishing is due to equitable benefits to their community. Building capacity was another, really focusing on health and policies 101 training. Was extremely fundamental, again, in developing all of those understandings. And then lastly, in that building capacity criteria, that they mentioned that dedicated staffing for health and policies would be really beneficial to their team, just making sure that they're not creating more disparities. Lack of data was a major component as well in the evaluation, really understanding that the struggle for finding reliable sources and enough sources to identify health disparities to adopt a health equity lens within their work was challenging. Also, lack of data really doesn't help with funding opportunities because numbers should prove. And also just the fact that data will provide a foundation to work towards policy initiatives. And then challenges to implementation. The COVID-19 pandemic really created a lot of different challenges to creating new relationship building, a lot of staff transitions, and then time just like continuously pivoting and moving those barriers. In addition, really around the educating administrators and policymakers on the value of health and policies, which was a challenge, partially due to the time crunch with the COVID-19 pandemic, but also just limiting to provide that opportunity for measurable outcomes in the case. So for recommendations and policy, the main takeaway here would be like that health impact assessments or health impact notes should be used to provide an explicit focus on health inequity and be included with policymaking considerations. In practice, utilizing the health and policies 101 training for professional development was key, and also really identifying what are funding for sustainability to support lasting positive impacts. And then in research, more research needs to be conducted to support non-traditional partners really better gain an understanding of health disparities within their work. and reliable data. Environmental scans on health and all policies approach implemented in other communities would be great. Surveillance research as well. And the creation of an interdependent database to support further intersectoral collaboration would be ideal. Thank you.